New data released today shows a staggering surge in the number of Americans turned caregivers for sick or elderly family members. A new AARP report says nearly 1 out of 4 American adults has taken on that responsibility. For tonight's interview, we are joined by AARP CEO Dr. Myechia Jordan. Dr. Jordan, thanks for being with us. A 50% increase in home caregivers. What accounts for that jump?
Sure. So, what we have is we've reached a crisis point in our country for our nation's 63 million caregivers. What we have is a confluence of a number of things, one of which is that we are aging as a population within the U.S. We have a number of individuals who actually are identifying themselves as caregiving as we are talking about this issue more. Additionally, we're finding that the issue of complexity is becoming more and more of a concern. The number of years that we're living longer, but we're not living healthier. And so we have more medically complex people who are requiring care for their loved ones that's contributing to this crisis that we're experiencing today.
Right. So not just more, but more difficult. Give us a sense, help people understand what life is like as a caregiver or a typical instance, although, of course, obviously nothing is typical.
Exactly. Everyone's situation is very different, but ranging from individuals that I've met, some of our members themselves who called us and who I've had the opportunity to interview. I think of a woman named Anna Tris, who I met with in Florida. She has a mother who has dementia and who she loves dearly and wants to care for, but is facing issues in terms of the rising cost of financial burden that caregivers face, up to over $7,000 a year for many caregivers, to the fact that she has to now coordinate her mother's care. She has to use her own retirement savings to take care of her mother. So we're experiencing that in many different ways. And obviously those who are lower income, who live in more rural areas, have less access to care, less access to services. But one of the reasons that we are partnering with the United Way is to be able to do just that, provide access to care and services through our 211 service that we've rolled out in 25 states around the country.
And Dr. Jordan, a number of those people caring for parents are parents themselves, so they've got kids on the other end of the age spectrum.
That's right. We have what we call the sandwich generation, individuals who are caring for young children as well as older parents. And in terms of our survey, we identified over 18 million individuals who fall into that category who are dealing with just that. We also know that at every point in life, we will either become a caregiver or need caregiving. And most support loved ones without pay, often taking time from work or from their other family needs. So this is indeed a crisis that we need to continue to act very swiftly on. We're focusing on passing state caregiver tax credits. We're focused on providing services through our affiliation with United Way through our 211 service. And we're also focused on highlighting home-based care and some of the technology that can support that.
You mentioned home-based care. Because give us a sense of training a little bit. How do we know how to care for our parents?
I know.
Yeah. Talk about that a little.
It's such a challenge. We have so many individuals, over 63 million caregivers in the U.S., an increase of over 20 million from 10 years ago, dealing with medical complex issues that they have no training for. And so one of the issues that we've surfaced from our members, hearing from Americans across the country, is that they need support, they need training. And again, part of our partnership with the United Way is helping to do that, but we're also fighting for additional resources, working with different states. Oklahoma became the first state to pass a tax credit for caregivers in 2023. Nebraska soon follows. We know that several states, at least 9, have since introduced tax credits this year that help provide that essential support, but training continues to be a significant issue.